Good morning, everybody, and to ministers and colleagues and friends. I was going to make some framing remarks, but in many ways, I think the framing remarks from our Secretary General captured the moment we are in and why this panel is so important. To state the obvious, health systems around the world are battered and bruised from a very difficult pandemic that probably caused the deaths of tens of millions of people around the world. Life expectancy declined during the pandemic and has not recovered in a large number of countries of the OECD. Certainly in the United States, our life expectancy is substantially lower than where we were. And there is a desire to move on. There is a desire to say, okay, the pandemic is over, we've spent a lot on healthcare, let's focus on other priorities. In that context, there are three phenomena that I think we need to grapple with. And I actually think they're not just the challenges, but they are in many ways the seeds of how we get to a much better place. The three phenomena I think about, and you're going to hear much more about this during the day, is the promise of genetic therapies, diagnostics, I think is finally arriving. 20 years ago, we were promised that the sequencing of the human genome was going to transform everything, and for a long time we kept waiting. But we are starting to see now rare diseases get treated, and in the next 3 to 5 years, we're going to see real genetic treatments for cardiovascular disease, for other common conditions. These are going to be extraordinarily effective and even more extraordinarily expensive. And we're going to have to manage that. There is a serious loss of trust in institutions across OECD countries, not just loss of trust in health, and public health, but loss in trust in governments, loss in trust of all institutions. That will hamper our ability to make real progress, and that is a challenge we have to take on. And then last but not least, and this is a conversation that this issue has been dominating our conversations. Anybody who was in Davos last week knows every single panel discussion began and ended with AI. AI is the topic. AI in many ways represents, the advent of AI in my mind in many ways represents what electricity represented 100 years ago. It will transform everything. So given that set of challenges, how do we move forward? And again, I think this panel will begin to lay that groundwork. I think embracing a real agenda of patient-centered innovation is the path forward. So what do I mean by that? The pandemic, as hard as it was, and we heard this from the Secretary General, was also a moment for incredible innovation. Not just the vaccines, but innovations in healthcare delivery. Healthcare delivery became much more patient-centered because we actually took away some of the rules that constrained us. Yes, telemedicine was brought up. I think about in New York City, we had nurses and pharmacists get into a van and go out into the neighborhoods and deliver care where people were. That was a really important innovation. It is critical that as we pull out of the emergency phase of the pandemic, that we don't say, okay, let's go back to 2019, let's go back to the way we used to do things, that we take those innovations of the pandemic and incorporate them and move them forward. Very excited about the Paris surveys. Look, we have to embrace as the metrics by which we judge ourselves patient-reported, patient-centered outcomes. We continue to have measures that we use that are very physician-centered, hospital-centered. Those are important. But understanding what matters to patients, measuring that, and embracing that and judging ourselves by that, I think is absolutely critical. And then the last point I'll make is about artificial intelligence, because every panel needs to begin and end with AI. Look, AI is going to be transformative. But the history of technology is that technologies don't always transform for the better. Technologies transform to the extent that we figure out how to use it more effectively. And to me, the biggest challenge of AI is not the technology, but reimagining the jobs of doctors and nurses and community health workers. I believe that today, a community health worker armed with ChatGPT 4.0 can do 80% of what doctors and nurses do better. therein lies our path forward. If we can relax some of our rules about what are things doctors and nurses can do, if we can bring more community health workers in, we will build more trust. We will deal with the healthcare workforce shortage. We will deal with the burnout problems. And we actually might be able to make care more patient-centered and cheaper. So I think AI has tremendous possibility. Now, I'm not wearing rose-colored glasses here. The challenges are enormous. But if health systems are willing to look at the hard questions of who delivers care, how do they deliver care, how do we enable technology to deliver care in a very, very different way, I think that is our best path forward. So thank you very much. I'm looking forward to our conversation, and I'll turn it over back to you, Sarah.
Thanks so much, Ashish. That's brilliant.